Obviously the conference is on the prevention of cancer. I have been working on the mechanisms by which aspirin prevents colorectal cancer for a number of years. What I explained was that the approach I used was to use cell line studies with higher doses of aspirin, then to repeat these with much lower, more pharmacological doses of aspirin, to look for those mechanisms that are absolutely required for the apoptotic effects of the agent, and then to go into more ex vivo and in vivo models to look at the translational aspect. What we have found from those studies is a network that's important for aspirin prevention of colorectal cancer that is focused around the NFkB signaling pathway. NFkB is active in the majority of cancers and it drives carcinogenesis. And what we have found is that aspirin actually activates the NFkB pathway, but rather than causing an increase in NFkB-driven transcription, it actually represses transcription. So it switches off NFkB activity, which causes the induction of apoptosis. And so the protein that I talked most about was a protein called COMMD1, which actually is the protein that switches off NFkB activity. People have shown that COMMD1 is reduced in a number of different cancers. So what I initially found was that aspirin actually increases the level of COMMD1 in colorectal cancers. And when at the same time I was studying the aspirin effects on COMMD1, a study came out saying that this protein was actually reduced in a number of different cancer types, and that the reduction of COMMD1 was associated with reduced survival and increased metastasis. And so because of the effects of aspirin on the protein, we decided to look at what COMMD1 was doing in colorectal tumours using immunohistochemistry with matched colorectal cancers and normal controls, a tissue microarray of 118 colorectal tumours of Dukes A and B, and we looked at cancer polyps as well, where there's areas of normal mucosa, adenoma and invasive cancer. And with all those studies, we could show that COMMD1 levels were actually reduced in colorectal cancer. There was an increase in that reduction in the more aggressive areas of the cancer and in more aggressive type of cancers. So it would suggest that, like the other cancers that were published, that COMMD1 is reduced in colorectal cancer and it's helping to drive the cancer progression. And the aspirin, what we've shown is aspirin increases those levels, so that might be how it's actually working. What I would like to do is be able to get hold of material from some of the other people who are at this conference, because what I would like to be able to do is actually look to see whether the aspirin causes an increase in COMMD1 in human material from patients who have been given aspirin in trials, and whether the initial level of COMMD1 can predict whether they have a response to aspirin or not, or whether aspirin causes a change in levels of that protein. And so yes, that's what I would like to do going forward, and at much lower doses.